There you go.
Excellent. Thank you, Molly. This is our February Vet Zoom with Dr. Stephanie Miesen. She's from the Country View Equine Clinic, and that's in Wisconsin. And I got your name because you speak, you and your clinic speak at every year at the Midwest Horse Fest. So you come highly recommended. So if you want to say any more, how long you've been there or what your special interests are, please feel free. I'm going to turn it over to you and your PowerPoint. And then people who are watching can just either raise their electronic hand or raise their real hand or put a question in the chat, and we're going to take questions as they come. And so let's get started.
Excellent. Well, thank you very much for having me. I won't spend too much time on myself, but definitely horses are what I do. It's what I've always done. Graduated from Wisconsin in 2008 and have been with Country View ever since. If you have any interest in our clinic, you can see my website address is right there. We're just north of the border by Madison, Wisconsin. We do not travel to Illinois, though. But I won't waste everybody's time with that, and we'll go ahead and get started. This is a talk I gave at Midwest Horse Fair last year called Diseases of the Equine Eye. Because as we all know, they only get 2 eyes in their life, so we have to take care of them. They can do very well with 1 eye, but especially in a competition horse, it is helpful to maintain our eyes. So I'm just going to get started with our normal anatomy because we do need to know what is normal for every horse. And we're going to go through these individually. You can see the list right here. But sometimes it helps to see what is going on the inside of the eye as well. So in this picture, we're going to have the horse's nose to the left and the tail to the right. And we're taking an inside look to this eye, and we're going to see this image coming up here again in the future. But the first thing we need to talk about are the eyelids. Even though that is not part of the eyeball itself, they are incredibly important. They produce tears, which have oil and other aqueous fluid to help protect the surface of the eye. So if we get something like an eyelid laceration, it can be very detrimental to the eye. If we lose the nice, I think you can see my cursor, that nice shiny rim around the eye, if we lose that, we can lose some of our good tear production. So it's very important that we maintain the eye. And horse eyelids. And horses do have 3 eyelids. They have the upper eyelid here. They have the lower eyelid here. And then they have a 3rd eyelid that slides underneath those. And you can just see the edge of it right here. That's that little bulbous thing you'll see in the corner of the eye. The interesting part about that 3rd eyelid is it is a passive movement. So they have a muscle in the back of their eye that pulls their eye to the back of the socket, and that provides space for that 3rd eyelid to come up. So if you ever wanted to look at that 3rd eyelid, you could very gently place your fingers above and below the eye and then push it to the back of the socket, and it'll let that 3rd eyelid come up passively. Then you can see if there's something stuck to it, if there's a mass or anything like that. So those are the eyelids. Like I said, lacerations do need to be repaired. This horse has an ulcer here that is a result of that of that laceration, but you can see here we have some stitches in place. We'll go through the rest of this a little bit later. But what can happen also as these try to heal is the eye can start to have entropion where it rolls inwards, and that will push the eyelids or the eyelashes onto the surface of the cornea, which can cause trauma. And that is actually what caused the trauma of this, not the actual injury to the eye, but the resulting entropion. So this was part of an entropion repair. And eventually this horse had basically no scar and the eye healed and did well. So I always consider eyelid lacerations that go all the way through and have a flap. They do need to be seen and sutured because we really need to keep the integrity of that eyelid going up. The other things that can happen with eyelids that commonly happen are tumors, especially when we have pink-skinned horses. Those pink-skinned horses get very sensitive to sunlight, and the sunlight can lead to tumors such as squamous cell carcinoma. And a horse like this, we often see people say, well, you know, my horse has pink skin, it gets sunburned. But what we're starting to see here, you can see how that looks a little bit raw right there. That's not a wound, that's actually a tumor getting started. So we need to be very careful with these horses, and we do need to provide them sun protection, whether that's a simple fly mask or even better yet, a fly mask with UV protection. Potentially even going so far if they're a stalled horse to stall them during the day and turn out at night to help protect them even more. But protecting those eyes. There are medications we can give topically when they're this small to help them. Um, but when they start to get bigger, we might have to do a bigger surgery, and I'll show you another image of that in a minute. Melanomas we will often see in gray-skinned horses, and they can be found throughout their bodies, but often in the eyelids as well. And so when we see those, we'll want to remove them before they become too big. As we come, oh, I thought I had another picture, it'll come up later. The second part of the eye is the conjunctiva. That's the pink tissue that is around the eye. Its purpose is to protect the eye and to fight off infection. So when we start to see goopiness within the eye, that tells me we are fighting off an infection, and we need to look at that. Allergies can also result in an increased mucus production, but that typically is going to be more white than what we see in this picture here. When I see this, I'm starting to think of an infection. And if it's something like pink eye, a true pink eye, that can actually be contagious to us as well. So it's important that if you're handling these horses, cleaning the goobers out of their eyes, that we are very good about washing our hands and sanitizing before we touch our face, because we start to itch ourselves, the flies are out, and then the next thing you know, we have pink eye as well. We're passing it on to other people, other horses. So when you see this, clean it, wash your hands, and then a fly mask to protect from flies, which can spread it around. So that is the job of conjunctiva. The sclera is the white portion of the eye. And you're going to say, well, I'm looking at this eye, this picture of this eye, and I don't see any white. Typically, we would see the white at the edge of this cornea here, but all of this is pink. And if you look really closely at this picture, you'll see there's a clouded area coming out onto the clear portion of the cornea with some vessels growing in. That's actually a squamous cell carcinoma, so another tumor that's growing onto the surface of the eye. If we catch it when it's small like this, if you're checking your horse just every time you groom them, making sure you look into the eye and take a moment to actually observe it, you're going to start to see this pink ridge coming around, or this soft, almost see-through area coming onto the surface of the eye. If we see this, we can treat this either with freezing or topical ointments before it becomes big. But if we don't catch it in this early subtle stage, then we might say that tumor becomes so big that we actually have to remove the eye to save the horse. So it's a good habit to get in, to just know what is normal for your horse's eye. If I don't have this, but I just have a rim, I can biopsy that to see if we do need to be worried about a tumor, or we can just monitor it, and if it grows, biopsy it at that point. The other thing you'd want to know is if that white portion of the eye looks yellow, we would want to monitor that. That can be signs of liver or hepatic dysfunction, but it could also happen if a horse is not eating the way that they're supposed to. Horses, unlike other species like humans and dogs, will become yellow or icteric almost as soon as they stop eating. In humans, it takes a while for that to happen, or some big liver dysfunction. In horses, it can happen pretty quickly when they stop eating. So that gives us an indication that they might not be out eating or grazing the way that they want to. So we'd want to do some blood work and an exam if you see that. So definitely watch that color. It should be nice and white. Unless it's like a paint horse breed or a horse with a little bit of a smaller eye, you shouldn't see it. We talk about seeing the whites of the eyes when they're scared. But if it's yellow or pink, raised or onto the surface of the cornea, then we'd be concerned. This is the one, I guess it was on the sclera. I thought this was a third eyelid, but this is the sclera. You can see this horse is an Appaloosa. And how do we know that? We know that because the skin is mottled around the edges of the eye. So we know there's some appy blood most likely in this horse. Again, we talked earlier about pink skin that is much more prone to developing tumors. But when it's not caught early, like it was in the previous picture where we have just that little rim right here, it will grow into this, and it grows over the surface of the eye. You can see how little of the eye I could actually find. And if I didn't have that completely wide open, you can see that this horse wasn't even visual anymore because it was covering so much of the eye. So this horse did have its entire eye removed. Luckily for this horse, it had not traveled into other parts like the bone or other tissues around it, because that is what would be the next step. When I see this, I'm actually taking radiographs to make sure the bone is okay. So that squamous cell carcinoma starts small, but you can see how aggressive and how bad it can be. And these pictures were taken right before we did surgery.
How long do you think it took to get to that level?
If you catch the subtle symptoms, you will notice. I took one out of a third eyelid last week, and she had been watching it for 2 weeks. She sees that horse regularly, and it was just in the corner of the eye. It was where you would see that normal little tiny bump that's in the corner of the eye, but it looked pink and raised, kind of like this was. And she said, that doesn't look normal. And she kind of treated it for 2 weeks and then called me, but it ended up being a tumor, and it was growing within that 2 weeks. So they can grow really fast. So it can pop up from almost nothing to this probably in a couple of months. But sometimes it's much more slow. So if we start with this and we don't catch it, it could take multiple months for it to get to this bad. So again, if you're checking those eyes once a week when you're grooming your horse, hopefully you're grooming your horse more than that, but if you just don't have much time and you're out there once a week, you should be able to catch things pretty quickly. So that's kind of the tissues that surround the eye and support the eye. They're very important. But we all came here to learn about eyes. So this is the eyeball. The cornea is highlighted in red. I told you we'd come back to this picture. And the cornea is a very, very clear tissue, and it has very few layers. We want it to be clear so that we can see through it. So it needs to be crystal clear. And as you can see, we have several layers. We have the epithelial layer that's several cells thick. We just have a little membrane. We have a nice thick stromal layer. We have a tiny thin membrane called Descemet's membrane. And then this is a single layer of cells down here. And those endothelial cells are going to be important in a few slides here. So just kind of remember this image in the back of your mind. It's going to come back. And then when we're looking at a 3D image, this is a human eye. I stole this off the internet, so please forgive me for that. But I thought it was a beautiful picture of the thickness of these layers. Nice thick stromal layer, but we get down here to the endothelium and you can see how thin it is. So this is one of the most common things we're going to see in practice is an abrasion or an ulceration of the cornea. You will remember this picture from earlier, but what we see here is this nice green spot. And what happened is I put stain on the surface of the eye. Put it over the entire surface, let the horse blink around. As you can see, you can't see any of that stain here. That is because the stain does not stick to the epithelial cells, but it will stick to the stromal cells. So if we make it through this top layer of cells, then my stain is going to stick. And so that's what you're seeing here. We lost the surface of this cornea and we're here into the stroma. So this is a common ulcer that we will see. Most often we will treat it with topical antibiotics to keep it from getting infected, giving them some Banamine or other anti-inflammatory for their comfort, and usually they're going to improve fairly rapidly. A non-infected ulcer is going to usually heal about 1 millimeter a day, so this is going to probably be less than a week before it's healed. So they'll heal pretty quick if they're not infected. But that's a big if. We don't want these to get infected, so I do consider these to be an emergency because maybe not in the middle of the night emergency, but fairly rapidly. I don't want to wait on these a few days because we can get further, deeper infections that I'll show you in a minute if we're not staying on top of those. So I don't like, if you're seeing a squinty eye that's tearing, I do want to have it seen so we know if there's an ulcer there. Because this is what happens next. We start to get infected ulcers. This particular picture is a fungal ulcer. You can tell before I stained it, we had a nice white thick rim. That is a very, very bad fungal infection. And fungal infections in horse eyes can set up shop really, really fast, and they can happen almost overnight. So that you could have a corneal ulcer, I'm trying to go backwards, a corneal ulcer that looks like this, and then show up 2 days later and see one that looks like this. Fungal ulcers are very difficult and very expensive to treat. It is hard to keep them under control, get them under control. And they can get so thick that the eye ruptures and that we lose the eye, we lose all vision, we can't get them back to comfortable, and we will remove those eyes. So this is what we try to avoid. We do have specific antifungal medications we can give, but they're very, very expensive. The other thing that can happen, this was a dressage horse. She still is, she's retired. And this is what we call a melting ulcer. This horse was in a trailer, came off the trailer with a little eye abrasion. Within a couple of hours, it started to look goopy. I'm talking 2 hours from when they took it off the trailer to where they said, that doesn't look right. They put it back on the trailer, brought it immediately to me. So I saw it about 4 hours, probably about 5 hours after it got off the trailer, and this is the picture I got. If this looks like it has a big goober hanging down off the surface of the cornea, that's because it is. This is actually the top layer of the cornea literally melting and becoming loose and hanging down, and I have a video of that in a minute.
Ooh.
Yes, those are no fun. We can lose these eyes very quickly, but it goes to show how fast things can change and how quickly, if you notice something wrong with your horse, how to watch it, because things can change in a hurry. So this is a video. I think it's going to play here. What you're going to see is I managed to get a nice video of how that is actually a goober moving around.
Oh my gosh.
Yeah, so you can see that. So this horse is heavily sedated. She's nerve blocked. She's not able to blink anymore, and she can't feel anything that I'm doing. I have multiple nerve blocks around the eye, because what I don't want to do is have her jerk, have me push into that eye and actually pop through that hole and rupture her eye. So we have to be very, very careful with those eyes. And then, because we have to be so careful, I don't want to have to put pressure on the eyelids and the eye to put ointments in. Plus, this horse is going to need treatments every 2 hours. So we don't want to irritate her. So we put in a subpalpebral lavage system. This is a tube that has a little end plate. We have a big needle. We slide it up underneath the eyelid and then come out here. And then the tubing just gets braided all the way to the back of the mane, so that we can stand back by the withers or the neck, feed them a treat, and give them their eye treatments through the tubing and never touch the eye. The horses mostly tolerate it pretty well. It can go, you can see it go both ways. It can go in upper eyelids, or we can set it down here in the lower eyelid. We do usually like to try to put it towards the front of the eye, because if you remember, we have that nice third eyelid that can come across and protect the eye if needed. So we do like to put it towards the front, but it can go lower or upper eyelid. And this one is in the upper eyelid. But if you are patient, and if you are lucky, and if you have a lot of dedication, you can save the eye. This horse did stay in our hospital for 3 to 4 weeks for us to do treatments, because the owner was not going to be able to give as much treatments as this horse needed at home. She was a very, very good girl, but we all have lives and it gets very busy. So the picture all the way over here on the left was at intake. I don't have the dates on here, and I'm sorry, I can't remember. I think this was 2 weeks later, and this was at her barn 4 weeks later. And you can see that melting, I never trimmed it. I never took it off. It just slowly started to heal on its own and started to fall off on its own. This horse did come back, had a very normal eye with basically 0 scarring, but it did take months and months. She did not need a full 2-hour treatment that whole time, but the initial month, 6 weeks, was you needed a lot of dedication and a lot of time. But we got very lucky. We did not end up with a fungal infection. It stayed bacterial, which is easier to get control of. And she did great. So what we have to worry about, I had mentioned that this picture was going to come back, is what happens when we have an infection that works its way through the entire length of the stroma and gets to this Desmond's membrane. That means we're in deep, deep trouble. We're down to that last layer of cell. And I know when we get here, because if you remember, I said the stain does not stick to the epithelial cells, but it does stick to the stromal cells. Well, it also does not stick to Desmond's membrane or the endothelium. So if I have a rim of yellow tissue with black in the middle of it, I'm very,
Oh dear.
yeah, that means one little push and I'm just gonna pop that one single layer of cell and rupture the eye. So this is what that looks like. This was a rescue pony. She came off of an auction lot. You can see we've got fungal infection because we have white. We can see we've got thick layers here. And this eye is not stained. Actually it was, you can see it in the other, but you can see how it's black right there in the middle. This pony did remain blind. She had 2 desmetaseals. You can also see it has been going on for a while because we have this brush border of blood vessels coming through, trying to get to the infection to heal it. They take a while to set up shop. Once they set up shop, they go about 1 millimeter a day. So, you know, 1, 2, 3, 4, 5. So it's about 5 days since it set up shop there. We worked really hard to keep this eye because the pony already did not have another eye. So it was a really sad deal. The pony is alive. She has very minimal vision, but you know, some pretty dedicated rescuers to get her to where she was. But if we see this, oftentimes I will be recommending an enucleation because to save these eyes and return to vision is going to be very difficult, very, very expensive and very time consuming. So oftentimes the horse is more comfortable. You will save money and are better off to remove those eyes. And one-eyed horses can do amazing even under saddle. It's just if it was a performance horse and if you have regulations against showing the one-eyed horse, then that is where we run into troubles. But most horses, I've known competition horses to do amazing with one eye. So that is the surface of the cornea. That's what I see the most commonly because that's just what's there and is getting hit and traumatized and infected. So that's gonna be the majority. We'll kind of get through the rest of this here because the next thing we'll get to is the anterior chamber. This is a very clear fluid that sits between the lens that focuses light and the cornea. But things can happen to it. Sometimes a horse will smack their eye, there's blood vessels, and blood will go into the anterior chamber and settle on the bottom. So what you're seeing here, it looks like a red line. That's because it is. This is blood that is just settled out. It is heavier than the fluid within the anterior chamber, and so it just settles to the bottom. Eventually that will form a clot, just like it would anywhere else, and reabsorb, if we're lucky, into the body with no lasting effects. But we do have to be a little bit careful because there is a drainage angle that allows normal current of the fluid, and that blood can get that all gunked up so that can't go through anymore. And then we develop high pressures within the eye. So we will put them on medications, A, to prevent infection, but B, to help open up this pupil wider. And so we'll do a dilator like atropine in the horse's eye. This horse resolved with minimal treatment and monitoring and did fine.
Dr. Miesen, I'm gonna
Yes.
totally be a ophthalmology nerd, but because I liked it a lot when I was in practice. I know that when pus collects in the bottom of the eye like that, it's called hypopyon.
Mm-hmm.
Remind me what the word is when it's red blood cells like that? Can you?
I cannot remember.
Oh shoot. Okay, I'm gonna look it up while you're talking.
There is a name for it, but I can't remember. We have had a case, I don't have any video or picture of it. It was a pretty fun case. Where we actually, I put a needle directly through the edge, right at the edge of the cornea, put a needle into the anterior chamber and injected medications to help dissolve and break up the fibrinogen and help clear that clot, because it was a different horse to clear that clot up because it was starting to get pressure changes because of that. If you think of that, find that name, you just pop in and tell us.
I'll put it in the chat or I'll tell you.
Perfect, thank you. But speaking of pus in the eye, pus looks like yellow. This eye looks yellow. There is a lot of fibrin and inflammation in here because this is what we call an anterior uveitis. Anterior means the front of the eye. We're in the anterior chamber. And so we have anterior uveitis. This is an inflammatory disease. It can be infectious, and it can also just be inflammatory for idiopathic reasons we don't know. Definitely the recurrent uveitis, the moon blindness, is part of this. But you can see how this eye looks hazy and yellow. It's hard to see through to where that pupil is. That nice pretty brown iris, we're having trouble seeing that. So if you start to see that cloudiness within the eye, that's really important to know. So the next thing is the iris and the corpora nigra. Iris is this nice, beautiful brown. If they're a paint horse or pink skin, they're going to have a blue eye. And then this little lovely goopy thing here is called the corpora nigra. I do like to point that out. Most of us have gazed very lovingly into our horse's eyes, and we have seen that. But many people haven't really realized that it's there, and they might see their horse in a certain way where all of a sudden it looks very apparent, like it does in this picture. And they'll call me because they think there's a tumor in the eye. And then while they can have tumors of the iris, this is very normal. But it can give me a hint if things are going wrong. With uveitis, for instance, this can actually adhere down to the lower portion of the iris. And then when the pupil dilates and becomes bigger, it'll actually, since this is stuck down here, will actually tear or connect to that area. So if I start to see tearing or issues there, then I'm worried that we maybe had uveitis in the past. So that's very normal, but also important to know what is normal for your horse and what your horse looks like. But we can have other issues. Potentially we have a melanoma tumor. All of these are iridial cysts, but we could have a melanoma tumor. Those can be difficult. That's the ones I'm going to send off to an ophthalmologist to determine if it is an actual cyst or a melanoma, because they all look very similar. Cysts can be normal and non-painful and do not bother the horse unless they get too big, in which case, especially in in bright light, when that pupil becomes much smaller, then all of a sudden it's covering a lot of the portion that they're looking for, and it can affect their vision and give them little blind spots that they have trouble seeing. So if that's the case and that's happening, we can send them to the ophthalmologist, and they basically use a little laser that comes in. It is attracted to the dark pigment of these cysts, and it basically pops them, for lack of a better way of explaining it. We treat the eye for a little while, and it goes away. I've sent 2 horses off for that. They did at UW-Madison at the time. I've sent 2 different horses, and both have done great, and they don't return. So a fairly quote unquote easy procedure if you know how to do it. I do not know how to do it, nor do I have the equipment. But it can be pretty successful. So if you notice that, what I typically do, the reason why I have so many pictures of them, is I take a picture to determine what they look like and to check their size. That way, when I recheck this horse every year, I will look at that cyst, and then I'll know if it's growing, because it should not grow if it's a cyst. So if it's growing, all of a sudden I'm worried about a melanoma, and they're going to go off to the ophthalmologist for a second opinion. So you can do this as well if you get in the correct light. Sometimes the easiest way to get a picture of them is to put your phone on video, turn the flashlight on so that it's on, and take a video, because they see that light and they start to blink, and then they might kind of settle down and then see, keep their eyelids open. And you might get 1 split second where it's open. But then once you have that video, you can get a screenshot, just pause it where you get a nice clear picture. And then you can get a good picture off of the still of your video. So if you ever need a good picture of your eye, that's the best way to do it. Of course, I get a lot of experience and a lot of handlers, and so I did not have to do videos for these horses, but that is one way you can get a good picture to send to your vet or for your records. This is not abnormal. As you can see, this is a paint horse, because even though we don't see white on it, we have a blue eye. I guess we can have non-paint horses with blue eyes, but this was a paint horse. But in 2 areas, you can see this almost looks like it bulges out at you. And this one, you can actually see completely through the iris to the back of the eye. How do I know the back of the eye is this nice red color? and we can see that red color. So that's called iridial hypoplasia. It's where it has not formed completely. We see this in blue eyes. It's normal in blue eyes, and it is not progressive. It does not negatively affect their vision at all. So if we're seeing it on a pre-purchase or, on a normal eye exam, we're going to mention it, but we're not going to be worried about it. It's not going to progress. It's not a sign of disease, and it does not affect vision. So I just like to say that so people don't panic when they look into an eye and say, oh my gosh, it's bulging out. It must have increased pressures, or it's going to fall apart, or there's something wrong with the surface of the eye. It is very normal. But again, if you're worried, you can always get a picture. That way you can easily monitor. So I think that's it for the iris. We're going to go on to the lens. The lens is a clear, solid portion that we look through. This is what we develop cataracts in. It sits here with these little fibers that hold it into place, and sits there and helps focus light to the back of the eye so that we can see. So this is a complete cataract. This is my picture. I was going to say this is not my picture. This is my picture. This was in a juvenile. Unfortunately, we had a juvenile cataract. And you can see that you can't even see to the back of the eye. It's completely white. And unfortunately, this little horse was born this way, and was completely blind. And we did end up euthanizing, unfortunately. Probably was infected, would be my guess, when it was still in utero. So that can be very sad. But we can have a complete, and so this is a complete cataract. You can't see it, but you can start to get senile cataracts. They can be little sparklies in the eye, and it can affect vision, especially as it gets worse. But many horses, it comes on slowly, and they're able to deal with that very, very well. On this one, this is a horse I also enucleated the eye on. It had chronic uveitis. We saw this horse the horse's other eye earlier with a tumor. But what we can see here is that the lens actually luxated where it came out of place, and it's sitting in that anterior chamber. So that's why it looks round and why you can see it. It actually fell out of place. So it's not doing its job anymore. It's a complete cataract, and the lens luxated out of place. So we ended up removing this eye as well. And this particular horse was completely blind. We removed both eyes in one day. And she lived, I think, for 2 years and did great. Completely blind. You need special care for them, but they did well. The posterior chamber, so we had anterior chamber. Anterior is front, posterior is rear, behind. So this is a very large chamber, and it also can be affected by inflammatory issues such as uveitis. And I know this is in the posterior chamber, and so we have posterior uveitis because we can see the iris very well, and we can see the lens really well, and we can see through the lens really well, which tells me all that infection is in the back of the eye. Because if it was in the front of the eye, if you remember, it was yellow and hazy and cloudy, and I couldn't see my pupil, I couldn't see my lens. So this is all in the back of the eye. Now I can't see through that to the back of the eye. This is not my picture. I also stole this one off of the internet. It's a beautiful picture, just not one that I took. That's usually what we'll see with the posterior chamber. That can lead to pressure changes, both low pressure and high pressure, which is glaucoma. If we get high pressures, it can affect our retina. Our retina is what senses all of the light in the vision that we're seeing and brings it to the optic nerve. So we are required to have this retina to be able to see. And it just connects to the back of the eye. And if it becomes detached, then we're unable to be seen, or we can't see, at least in that area that's detached. But if you think back to that picture a couple of slides ago that was bright yellow, we can't see through the back of the eye. So how am I going to decide if that retina is intact? The horse can't see out of it, so I can't do a menace response. The light might not get through the back, or I might not even be able to see the pupil to see if the pupil is responding to light. But I need to know what that retina is doing. So I need to, because I might be deciding, do we try to treat this eye, or do we decide to remove the eye and enucleate it? So that's where ultrasound comes in handy. Ultrasound is very easy to do in horse eyes. And as you can see, this little white line here, this is the back of the eye. And then you can't really see, but the cornea is at the very, very top. We kind of squished it. We do not have a standoff on this image. This is our lens. We have a nice intact lens in the proper space. Other than one little spot, it's very clear. But this is the retina. The retina comes right here. If you can imagine this little space, that's the retina. And then you can see it stops and it starts to float up into the eye. So this horse did have a partial retinal detachment. And we did end up, eventually we tried to help this horse. Owner wanted to try, we gave it a good effort, but we did lose the battle and eventually lost the eye. We removed the eye on this one. Optic nerve, that's something I'm not going to get into today, but that is one of the things we look at when we do our exam. But we do have this retrobulbar space, and retro is behind, bulbar is the bulb of the eye. So that's this big space in the back of the socket, because that can also put pressure on our optic nerve, can put pressure on the back of the eye and push it forward, which creates pressure changes within the eye, as well as if it's bulging, our eyelids are not going to close very well, and we're going to have some issues. So if you look at this horse, this is a good old boy. He died of old age, not because of the eye. But this is a horse I had known for many years, and I showed up for a spring visit. And I said, hey, what's going on with his eye here? How long has it been that way? And they got to looking. He's retired at this point, and they got to looking and they said, yeah, it's pretty big, isn't it? But he was non-painful. As you can see, his eye is wide open. He has no tearing. Well, a little bit there, but that's just his normal. He had that on the other side too. He's visual. He was looking around, not bothered. I could push on it, poke at it, prod at it. He did not care one little bit. In this image, you can see how much it's bulging out. We're seeing that third eyelid start to be more visible, and you can see how tight the eyelids are because it's actually just getting pushed out with that eye. So I did an eye exam. The eye itself looked very normal. The back of his eye looked very normal. Everything looked good. So I asked him if I could bring out the ultrasound, and I threw the ultrasound on him. This is the back of the eye, posterior chamber. And then this is a melanoma tumor, an assumption of a melanoma because he is a gray horse. This is a tumor here that was sitting in the back of his eye and taking up a bunch of space and pushing that eye. We decided for that guy, he was so comfortable. We decided not to do any type of surgery. He was older. He was in his mid-20s at that point. We decided to monitor. He did great for years until just old age caught up with him. He never did tear more than what you saw in that picture. He never became uncomfortable. So we just left him alone because we have to think about the whole horse and what is right for that horse, and putting him through a surgery just wasn't in his best interest. So that was him. I kind of flew through those. Usually I have a lot more questions because I'm doing it usually in person. But I would like to point out this little wonder pony only has one eye. Her name is Cheyenne. She is in her mid-20s. I've known this pony for a very, very long time. She was one of my first patients when I graduated in 2008. My youngest son was born in 2013. And now she is my daughter's pony. I've known her through 2 owners. I'm now her 3rd owner since I've known her anyway. She's a great pony, and you can see how much I trust these one-eyed ponies. They do amazingly well. She packs my little girl around and keeps her safe and never spooks. She does not love it if a horse is on her right side, so we're just careful about that she knows they're there. But I have a lot of people who are worried about removing an eye because they're worried the horse is not going to adapt well. Most of the time, the horses are going to adapt amazingly well. The other thing people worry about is the look of the eye. Now, she is a darker horse, so it does hide it a little bit. But this is what an enucleated eye with no implant looks like. It does look like a big divot in the skull. You do get used to it very quickly, but that is a fear people have, and it will delay their chances of having surgery because they are worried about what that eye is going to look like. If it does bother you and you have seen pictures and you don't think you're going to get used to it, there are, like if you go to a referral facility, I personally don't use them because I can't keep them in stock very well, but there are implants you can put in the back of the eye. It doesn't look completely normal. It doesn't look completely like a closed eye, but it prevents the sinking to the back of the eye. so that it looks slightly more normal. So that is always an option too. It does add to the cost, and it does add to the chances of an infection. It's rare, but it does increase the chance just a little bit. So that's what we have for the eyes today. I'm sorry that it went so quick. I think I actually ran out of time when I was up at Midwest Horse Fair. But does anybody have questions about anything I covered or anything else on the eyes?
I have
I
to
did
say,
find-
oh, I'm sorry, go ahead.
Well, I did find the name of when red blood cells collect in the anterior chamber, it's called hyphema.
That's what it was.
That's what it was. Yeah.
I was trying to think of all the Latin words for blood, and I just couldn't come up with it. Thank you for looking that up.
The having gone through a major eye infection, this was very, very helpful to understand a little bit more about, even though it was a while back, about
Yeah,
what he went through. And you are absolutely right. They get used to not having an eye. They get used to, I mean, I told you the story about him doing the
yeah,
Grand Prix test and the I2 test with the left eye completely closed, never opened it during the entire test. And he was perfectly fine, perfectly
yeah.
fine. And
I
it
have
really helps if they have, it really helps if they have a rider who they trust. Because
absolutely.
once the trust is there, they don't spook any more than
Mhm.
they would, normally, under normal circumstances. So the eye is a very delicate situation.
Yeah, I think it's just important to know that things change in a hurry. So you need to know what is normal for your horse. Having Banamine on hand helps with eye pain if your vet allows you to have Banamine on hand. Having a antibiotic ointment with no steroid to have on hand can also just buy you the 12 hours. Let's say you go out to feed, it's 9 o'clock at night, your eye is squinty, it's tearing, you can tell it's uncomfortable. Definitely call your veterinarian. You do need to get on their radar about it, get their advice on it, potentially send them some pictures. But oftentimes, if we can give them a little Banamine and get an ointment with no steroid in it, it can just buy us the 12 hours until the vet can come out during regular working hours and potentially save an emergency fee. Now, I might see a picture and say, no, this needs to be seen tonight. There's some things I'm seeing that concern me, then definitely have them out that night. But sometimes I get the pictures, I'm like, oh, there's probably a little ulcer there. Let's start the antibiotic ointment. The reason why I stress to have zero steroid, I don't even like people to have leftovers in their barn, is because if we have, horses are particularly sensitive to it. If we have an eye ulcer and we put a steroid ointment in it, we can set that ulcer back a long ways, and we really risk a fungal infection. So we can make things worse with a steroid eye ointment. That is different in other species. In humans, and I think even in dogs, and I don't practice on dogs, they can put steroids in, even though there's an ulcer there or a scratch there. We cannot in horses. We're really risking a lot. So because of that, the tubes look very, very similar. Even the boxes look very, very similar. So just making sure there's no steroid in it. But that's a conversation to have with your vet. Every vet is slightly different in their comfort levels with what they want done. So having that conversation of like, hey, if my horse had a squinty eye and I give you a call, like, should I have some of these meds on hand? That's a conversation to have with your vet, but it can sometimes just give everybody a break for 12 hours while you start treatment, and then we just double check the next day that we don't need to
You
do
know,
anything different.
the infection I was talking about earlier, it
Mhm.
went from 0 to 60 in 4 days,
I
okay,
believe it.
with
Mhm.
treatment.
Yeah.
Because we caught it after about, we noticed it about 4 hours before the first vet visit, okay,
Mhm.
and they were working on it, and it still went to a place where they were going to have to take the eye out. So,
And I
um,
believe you said, if you don't mind me saying, that it did end up with a fungal infection. Is that correct?
the really bad one, they couldn't keep it
Yep.
under control. I don't
Yep.
know where he got it, but
Those
it,
fungal infections, every minute counts. They are bad. They're very, very hard to treat. If you guys are traveling, if you're showing down in Florida, but the further south you go, the worse it is. We're very fortunate up here. We have less fungus because, as much as I hate the 30 below wind chills, they have a purpose. They like to kill things in the environment. In Florida, where it's hot and humid, those veterinarians down there are treating basically every eye they see gets on an antifungal immediately. I rarely put a horse on an antifungal unless I'm suspecting a fungal infection, but down there, they're seeing it. So it's important to know that things are different regionally. So if you are traveling, you do need to contact a local vet because, or a show vet that's on the grounds, because they're going to know what is very normal in their area. And if you call me and I'm like, and you're like, hey, I'm out of town at the show, I'll be like, sure, just, use your Banamine, use your eye ointment, watch it really close and call the local vet if it's not improving. But I might not know that you're in Florida and that fungal infections are bad in Florida and they're almost a given. So it is very important to reach out to the local veterinarians as well if you have an emergency while traveling.
Yeah. Yeah.
Yeah.
So at our barn, we have a completely blind horse that is
Mhm.
taken pretty good care of. He had a buddy, and
Mhm.
she moved the buddy, so he's now by himself in a paddock with horses around him.
Yeah.
And then the people they give lessons, and they
Mhm.
figured out that you can buy ponies like this with one eye pretty cheap, and they're
Mhm.
fabulous. So
Yeah.
almost all of their kid lesson ponies are one-eyed.
I love that. I love that so much because people sometimes don't give them a chance and they're
Yeah,
gems.
yeah.
Um, and I have known in my practice 4 completely blind horses. Some were patients and some were friends and some were a combination thereof. 2 of those 4 horses were ridden and completely blind and trail ridden completely blind to the point where they would go well, one of them would go off property to trail riding, and people riding with her wouldn't even believe her she's blind, and so she'd take her fly mask off and turn the head both directions, and there was 0 eyeballs in the horse. They were both removed.
Wow.
So 2 of them have done great. One did okay for 2 years. She was not a riding horse, but in a very controlled situation, she did well and she was quiet and it was fine. And then I have another one that is a little more high strung, and she was more high strung before we ever removed the eyes as well. Her eyes were extremely painful. So she did get a little quieter after the eyes were removed because she was in less pain, but her baseline temperament is a little bit more of a nervous Nelly. And so we have struggled a little with keeping her calm. She's safe, she knows her surroundings and she knows her pen, but keeping her calm is hard.
I have an idea for you we can talk about offline,
Excellent,
but
that would be great.
there's a question in the chat.
Okay,
It's can you see the chats for you?
I
I
might
can
have
read it
to,
to you.
yeah, why don't you do that?
Okay. Um, is there anything that can be done to help prevent or lessen recurrent uveitis in Appaloosa type horses?
Yeah, yes, not to make it go away, but those horses unfortunately should live on an anti-inflammatory. Oftentimes we use something like Equiox or furocoxib tablets because it's safer on their GI tract. But depending on how they respond, there are cyclosporin implants that we can do to help them keep the body from attacking itself. You can try the drops first, and if you're seeing good luck, you can go to an ophthalmologist and they can do that implant. I have had 2 horses do that and be quite successful because it just releases that drug all the time. Not every horse is a candidate, but it is something to think about and see if your horse is a candidate.
Wow. That's pretty cool.
Yeah,
I
there are amazing things the ophthalmologist can do. There's a couple schools, I think Iowa does, maybe Minnesota, that will actually do like if you have a complete cataract, they'll remove the lens. Your horse will be visual. They won't be able to focus as well, but they can have a return to vision. So there are a couple places that will remove lenses.
I'm going to the University of Minnesota College of Vet Med tomorrow.
Excellent. You should ask them if they'll do it.
I will.
Yeah.
Yeah.
Yeah. I think they do. Iowa did, at least in the past. It's been a little
Mhm.
while since I had anybody I had to look into it.
Mhm.
But Minnesota has such a great school up there. I wouldn't be surprised if they have an ophthalmologist that
They
would.
have that Piper Equine Center, the
Mhm.
Leatherdale
Yeah. Yeah, they got a great facility and a great staff. Yeah.
I have one more question for you. So the horse at our place that's totally blind, Dodgy,
Yes. Mhm.
he looks to me, I was taught, and we had some great, I went to Illinois, we had some great ophthalmologists,
Yes.
and I was taught that red eyes, you know, testicle bulbs, shrunken eyes, they're painful,
Mm.
and you should take them out, and the horses will be more comfortable. This horse has an eye, like one eye's been removed and the other eye hasn't.
Mhm.
I can't convince the owners to take out the other eye. It's like
Yeah.
they think, oh, maybe, but that's the only eye he sees with. No, he's not seeing with that eye. It's not functional. And I'm sure it hurts him.
Yes.
Is there anything I can say
Yeah.
to?
If you, man, they've already had one eye removed. So the hard part is sometimes what we'll do is have one client that is on the fence about removing an eye, call another client with permission. We get them together because what can happen, so it's similar, a painful eye, and then this is a whole nother topic, but a painful incisors with a disease called EOTRH. You have older horses, you might have heard of it. They are diseases that are very, very painful. Our head is extremely sensitive. We have lots of nociceptors and lots of pain receptors in these areas. But our horses, as a general rule, I don't care if you tell me that your horse is a delicate flower, our horses are tough. They hide pain. That's what they're designed to do. So we have eyes that we remove, and the people go, I had no idea how painful my horse was until we removed it. They're acting 10 years younger. They're happier. They're eating better. They're gaining weight. We'll see the same thing with those front incisors because our head is such a sensitive area. So sometimes we have to, I personally call it the hidden pain of horses because they don't tell us. I had pink eye once when I was in college. I thought I was going to die. I couldn't even like open my eyeball. I could barely drive to the hospital. I thought that the world was ending. Horses have pink eye and they go about their day, right? They just say, we're going to be a trooper. Maybe I'll squint, maybe I'll tilt my head, but I'm going to go and grit my teeth and bear it, grit and bear it. So we call it the hidden pain. So, but if you can get them to relate somehow, but if it's a shrunken eye and it has a lot and it's collecting stuff and getting drainage and goobering, that's all the body fighting inflammation and infection. It's a constant battle that it's doing every day. So if you can try to bring it into terms that they can bring on to themselves, sometimes your teeth hurt because your eye hurts, or your eye hurts because your teeth hurt. Like everything is connected. I think I saw on your website, you're going to have another speaker next who does acupuncture and chiropractic, and man, listen to her talk because those modalities treat all of this nociceptive pain, things that I'm dampening with medications like NSAIDs, like bute and Banamine and Equiox. But we can actually trick the body and the nerves and the brain, and train the body to dampen all that nociception that we're having, by triggering appropriate nerves to come back and fire. It's a very interesting thing. But goes back to how painful we are and how much of those nociceptors are in this area of our face.
Yeah.
Okay, any other questions? Thanks, Karen and Karen, for sticking it out.
Thank you, guys.
And thank you for volunteering your time tonight. And
Absolutely.
maybe we'll get to see you at the Midwest Horse Show.
Yeah, stop by.
Yeah.
Country View will be there. There's a lot of good talks that's going to be there this year. I'm on our clinic, are the vets for the whole fair for the weekend. And so I'm there for a lot of planning meetings, and I've had a chance to get a pre-look at all the talks this year. And there's going to be across the board a lot of great talks.
Great.
Excellent.
Thank you
All
so
right.
much
Yeah.
thank you for doing this for us. And I wish you the best of luck in your presentations at the Midwest Horse
Thank
Fair.
you. Thank you.
Thank
Okay.
you.
You're welcome. Thank you.
All right, everybody have a
Okay.
good evening.
Bye,
Bye-bye.
everybody.